Hey everybody, let's talk a little bit about fibromyalgia today. So fibromyalgia is a common diagnosis that people get, actually mostly women, and it's a very frustrating diagnosis for women. What happens is basically doctors push on your body in several different spots, and if you have pain in multiple spots without a reason, without a diagnosis they can think of, they just say, well, you must have fibromyalgia. So fibromyalgia, it's not actually clear what the reason is. In the standard of care in Western medicine, they actually don't really know or have a real good diagnosis. They think that it could possibly be autoimmune, and they're not really sure. And when you look at how do they treat it, you start to get a little glimpse into how they're thinking about it. One, they might give you pain meds, and oftentimes it doesn't help. And if it does, it's temporary, and nobody wants to be on pain meds for life. Two, they'll start to give you SSRIs, which are basically antidepressants like Zoloft and Effexor. And then you start to see that some patients actually feel better. So the current thinking is that maybe fibromyalgia is more of a mental issue. And I would argue that it is not. It definitely has physical reasons for it and diagnoses. So what we see for fibromyalgia, the main causes are this. Oftentimes women have hormonal imbalances. They always have some kind of digestive compromise, which makes their muscles hurt. They can also have a hyperstress response that affects their cortisol. So these are all things that can be tested and measured in labs and things that we test all of the time. And when we treat this, we get a very good result with this condition. It's something that responds well to things like acupuncture. It responds tremendously to Chinese herbal therapy. And when you couple that with all of the labs, when you look at the cortisol, the hormones, what's going on in the gut, then you can really come up with a precise treatment plan that you can systematically improve the body, and you can reverse fibromyalgia where they no longer feel that uncomfortable or have to stay on SSRIs, this Effexor, Zoloft, Prozac, for the rest of their life. Who wants to stay on that for the rest of your life? I know I personally don't. And what are the risks? It messes with your brain chemistry. Higher risks of things like dementia, Alzheimer's. You can have sudden suicidal ideation. So we take your condition seriously, and what we want to do is we want to analyze and find out what exactly are the causes, and something like fibromyalgia is treatable, reversible, and responds well to care. I hope that was helpful for everybody. We'll see you again. Bye-bye.